Hi, my name is Zachary Dubois, and I'm an assistant professor in the Anthropology department at the University of Oregon. My pronouns are he, him, and today we're going to be presenting on trans resilience and health amidst COVID-19, sharing some of the experiences of trans and gender diverse people living in Michigan, Nebraska, Oregon, and Tennessee during the COVID-19 pandemic of 2021.
Hi everyone, my name is Jay Puckett and I'm an assistant professor at Michigan State University in the Department of Psychology. My pronouns are they, them. Okay, and as we get going today, we wanted to take a minute to acknowledge the many people who contributed to this study. This was a very big undertaking, and so we had many people involved, and it wouldn't have been possible without such a large, dedicated team. So in addition to our co-authors on the first slide, we were joined by all the folks listed here who contributed in some way. If you'd like to find out more about our study, you can go to transresiliencestudy.com to find out more about our team and our methods. So given the existing research, we know that trans and gender diverse people are exposed to many hardships in life, such as encountering significant barriers to healthcare overall and to healthcare that is inclusive, as well as high levels of economic hardship and homelessness and high rates of exposure to violence and discrimination, as well as many other minority stressors that exist. We also know that these minority stressors have a significant impact on health and well-being. Past studies have shown associations with depression and anxiety in addition to suicidality, as well as risk for chronic disease. During the COVID-19 pandemic, these social inequalities have been exacerbated. This has included trans and gender diverse people reporting reduced income, high levels of job loss, as well as less access to health insurance. All of this, of course, has important implications for the already disproportionate health disparities in our communities. In addition to this, many trans and gender diverse people have reported reduced access to gender affirming resources during the pandemic, such as access to gender affirming healthcare, like hormones or surgeries, and many people also report spending less time living in their affirmed gender. This could be due to a variety of factors, such as living with folks who might not be affirming or less secure housing. This might particularly be the case for youth and young adults that might be more isolated and living with families that are not supportive of their identities during the pandemic. This reduced access to care and affirmation of folks' identities, of course, has implications for psychological distress, and we see that this can be associated with worse mental health. So although there are significant hardships experienced by many trans and gender diverse people during the pandemic, some people might also have experienced a reduction in exposure to some of the minority stressors as a product of just being out in the world less and having less interaction with people, even though, of course, that also means folks are experiencing more isolation. So in addition to some of the research that we've seen so far, there has been less focus on resilience during the COVID-19 pandemic. And so our study wanted to take a look at some of the nuances in folks' experiences during the COVID-19 pandemic and how resilience might be showing up in their lives. So in terms of the overall study, the study was conceptualized by myself and Dr. Dubois around October of 2018. And this is when the Trump administration was in office. So during that time, as we all know, there were a variety of policies that were being enacted that brought a sense of urgency for us, where we really we really wanted to study the effects of social political context on health and well-being for trans people, in addition to ways of being resilient in the face of these challenges. So these were our overall aims for the project. We wanted to document how shifts in sociopolitical context relate to shifts in stigma, resilience in both mental and physical health. We also wanted to describe the ways that trans people show resilience in the face of stress and stigma and how this might differ across contexts. We also were interested in how geographic location and local context shapes exposure to stigma, experiences of stress, resilience in both mental and physical health. So in order to achieve these aims, we recruited folks across 4 different states: Oregon, Michigan, Nebraska, and Tennessee. And we intentionally recruited in these states given the range of sociopolitical contexts that we're talking about. So Oregon has the most policies and protections in place for trans people. Michigan is kind of a mixed bag with some protections, but not others. And then Nebraska and Tennessee had the least policies in place and had more negative context for trans people. So in terms of our methods, participants were recruited through a variety of means, including online, through social media, community organizations, and outreach and in-person events, and snowball sampling. To be included in the study, participants first had to complete a screener, and after we reviewed that data, we enrolled folks in the baseline part of the study. And so for baseline, this involved a pretty extensive in-person visit where we conducted an interview lasted about an hour's worth of measures and surveys that folks completed, and then biomarker collection. After the baseline part of the study, we then moved into online surveys for 1 year in order to see how the shifts in social political context related to shifts in health and well-being and resilience. And then we are now in the process of doing our final interviews and in-person biomarker collection. So the initial data collection for the baseline part of the study ended in March 2020, and then we shifted to the online data collection for the 12 months of surveys from April 2020 to March 2021. And this also aligns with the pandemic. So we initially had goals of a higher number of participants in our study, but given the start of the pandemic and everything, we went ahead and shifted to the online 12-month surveys as soon as that started. So that created a unique opportunity for us to actually look at some of this, the effects of the pandemic in our sample. So overall, we had 158 participants with an average age of 33 years old. Participants had a variety of gender identities, including trans men, trans women, genderqueer and non-binary participants, as well as many others listed here. Most of our participants had housing at the time of the study and were either employed or a student. And then, as is common in many trans samples, most participants had financial strain, with over half of our participants earning less than $20,000 a year. In terms of recruitment in relation to race and ethnicity, we ended up with a sample that was 69% white. And now I'm going to turn it over to Zach so that he can tell you a little bit about our monthly surveys.
Thanks, Jay. So after completing the in-person baseline interviews and biomarker measures, participants were asked to complete monthly surveys. So those started in April of 2020 through March of 2021. And in that COVID questionnaire that we developed for this project, we had 2 open-ended questions, as you can see here. And we conducted thematic analysis with 2 independent coders, iteratively generating the code book and applying those codes, resolving any discrepancies through consensus. As you can see in the table here on the left, the most commonly reported contributors to resilience and well-being described by participants focused on things outside of themselves. So we first broadly coded these as focus outward, applied that code to 1,184 excerpts from 149 participants. The emerging themes within this broad category are shown here in order of frequency, with connection being referenced most frequently, with 134 participants mentioning this 679 times over the year, for example. We defined our codes in the box on the right, so connection with other people or animals in ways that provide comfort or boost resilience. In terms of codes reflecting more of a focus outward, the next most frequently mentioned was distraction or immersion in things like nature, TV, film, games, books, really anything found to draw and focus attention in ways that were enjoyable or distracting from the challenging reality of the moment. We also coded excerpts of text where participants described focusing inward, so on oneself, with the most frequently mentioned of these being self-care. So these are behaviors that are found to be calming, soothing, or improving of physical or mental well-being. The figure here on the right lists the many other themes that we identified, reflecting what participants found contributed most to their resilience this past year. And when we examined these across the 4 states, so Michigan, Oregon, Nebraska, and Tennessee, where study participants were living, these 3 themes of connecting to others, self-care, and distraction or immersion were consistently the most common and referenced by the most people over the course of the year of data collection. We also learned how remaining busy with work or school, avoiding news and social media, accessing help like therapy was helpful to people as was making things and maintaining daily routines, practicing religion and spirituality, recreational and medicinal use of drugs and use of alcohol, and building new skills. As you would expect, these different strategies intersect in a number of ways for people. So here you can see that 39% of the references to distraction and immersion included references to connecting with others, for example, visits and walks and venting sessions with close friends outside. So the participant, this participant was describing that intersection there. Similarly, 23% of the references to distraction and immersion included mentions of self-care. So here, for instance, where immersive activities like reading are described alongside calming practices of self-care like burning incense. So using mixed methods to drill down and make comparisons across subgroups for self-care and connecting with others, we found similar frequencies across gender, age, race, ethnicity, relationships, and living situation categories. But when it came to distraction and immersion, half of the participants in each of these generational cohorts mentioned some kind of immersion or distraction, but we found differences in the type of activities that individuals described in each of these groups. And in these boxes, you can see quotes from participants summarizing these. Gen Z, so those participants that were 18 to 25, described immersion in video games. Animal Crossing was particularly popular, but there were no participants in Generation X or millennials who mentioned video games. Instead, those were much more focused on avoidance of media, both news and social media. Boomers were actually a mix and reflected a group that some were really engaged in social media and others also were in avoidance. Across the 4 states, as you can see here, the blue bars here are reflecting that showing that 30 to 55% of participants wrote about the positive impact of COVID mitigation policies and practices. The yellow bars are showing specific references to vaccine. But they're describing the positive impact that these had on their resilience and their well-being specifically. Most interestingly, though, are differences in how they discuss these experiences. So for instance, all of the participants from Tennessee who reference policies in some way are describing the benefits of working from home, self-quarantine, or as this quote reflects, controlling what I can, like going out infrequently, wearing a mask, convincing my husband to wear a mask to work, and not dwelling on things that I can't. So these are reflecting individual level focus and tensions around mask wearing, controlling what you can. Similarly, in Nebraska, participants mentioning individual actions that could reduce risk, making sure I'm not putting myself or others more at risk than necessary. I'm going out even less. This points to some of the increased potential for isolation and the risks associated with that. But when we compare these to Oregon and Michigan, where participants mention the benefits of their state's policies and approaches, so making sure having the ability to quarantine and get supplies safely in environments that are very pro-mask. Now, although we know there's a lot of conflict and division within these states, as well in these regards, in general, these are showing that individual level impacts of some of the state level policies have. And this is not just through individual practices like mask wearing, but the real hope and optimism that these policies provide were referenced a lot in terms of our study participants' concerns. In terms of vaccines, for example, though, early in the study, all of the vaccine mentions were simply hopeful. They didn't yet exist. And then more recently, in the final 3 months of the online survey, these became more descriptive as people began to access the vaccine. The interaction of mask wearing and gender experience is really interesting. It's also coming up in our ongoing final round of interviews. So just to give you a quick sense of what we're seeing here, some people wrote about this under that second question where we invited participants to share anything else they wanted to add. And the figure here is showing you overall that trans women and non-binary participants express more positive experiences with mask wearing with regard to mask wearing, and trans men express more negative experiences with regard to mask wearing. In fact, we didn't have any positive experiences described by any trans men in the study or trans masculine participants. So this quote from a participant in Tennessee shows the way that the local level contexts regarding masks present unique challenges for trans people. They say the risk of folks yelling at me or otherwise being rude about me wearing a mask is amplified by my trans experience. Garnering negative attention is already something I fear for reasons unrelated to COVID-19, so this just compounds that. So this is another way in which those in our communities might experience the increased anxiety and risk for harm, especially that trans and gender diverse people face when experiencing unwanted or negative attention, exacerbated in the context of COVID-19 and in particular with the political divisions in the United States. In terms of positive experiences, non-binary study participants shared, I have come to appreciate my mask and the anonymity it gives me. I don't get so many unpleasant looks and I can just go get my groceries and go. And a trans woman shares, wearing a mask really helps when my depression prevents me from having the energy to shave. So both of these are examples of what I'm referring to as gender work, the literal labor and time we put into doing gender within the context of stigma and the gender binary in particular. In addition to reducing some aspects of gender work, though, mask wearing varies also based on gender identity and expression. So as I indicated earlier, trans women in our study describe reductions in misgendering. So more positive examples, I get clocked less with a mask, so that's nice. Or I'm hiding behind a face mask. I've been treated with more respect and I'm not misgendered at this time to my face. Whereas trans men describe the opposite. So an increase in misgendering. Wearing a mask causes strangers to misgender me, refer to me as ma'am all the time when I'm wearing a mask. So I basically don't go out much at all. These are important takeaways in my view to be able to consider some of the other risks and variation in our communities and our experiences and how we might provide supports. One final challenge that will be important to explore further is related to financial insecurity, particularly for trans people under 30 and the experiences of living with unsupportive or less affirming family during quarantine. A number of participants talked about moving back in with family at this time. And one participant described this saying, "It feels like I'm living as someone else. I get dead named, misgendered constantly by my family. I'm not out to them." So this points to an obvious other area of concern, especially with the very high rates of suicide within our communities for youth in particular. So as we've shown, people did whatever they could to cope and be resilient in light of the COVID situation. But their means of resilience did vary by the resources they had access to, including who they could connect with and where they lived. Individuals were directly impacted during this pandemic by their gender experience, of course. And as we saw in cases where folks had to move in with non-affirming or hostile family members, for example. Likewise, wearing a mask had different and disparate effects on our participants, as we've detailed a bit here. Moving forward, we're going to continue our analyses of these data and integrate in the interview and biomarker data in order to contribute to understandings of trans experience, health, and resilience, particularly during this exceptionally challenging year. Thank you.